Hi, Dr. Brent Reynolds here. I'm a chiropractic neurologist. I'm board certified in neurology and as well as neurofeedback. I practice in Smithtown, New York. And I want to talk to you today about concussions and baseline testing for concussions before testing someone who has no symptoms before the concussion happens, and so we can help them after that, getting a normal reading. And so concussions have been in the news a lot lately. They've gone up 16.5% in the past 10 years in student athletes. And it's important to realize that a concussion is a mild traumatic brain injury. They can be severe where the person was rendered unconscious, but most of them happen with, little or no contact. You can have a concussion without being hit in the head. Usually there's nausea, vomiting after, headaches, people feel fatigued, a little bit of disorientation, but there's a scope, or there's a range of symptoms that can occur. A lot of times the brain just moves forward and backwards in the skull and causes some damage. Most people, most students, kids who have these recover without any treatment. They just sort of rest and they get back into the sport gradually, and hopefully avoid future concussions, because it's usually the second and third one that cause a significant amount of problems. And their research even shows that down the road, Alzheimer's disease, Parkinson's, there may be some connection with previous concussions in adolescence. So it's a really serious problem nowadays, and for everything from soccer, from headshots in soccer, hitting the ball with the head, to football, can cause these things. People having their heads whipped around can cause a concussion. So it's very serious, and we want to have a way to look at the brain's function before a concussion happens. Take a normal picture and see what we see. And so the person has like a snapshot, so that when they have a concussion, if they have a concussion, God forbid they have a concussion, that we can see how much change has happened from what we consider normal or having no symptoms. So there are different ways to take pictures of the brain. You can take an MRI, you can do a CAT scan. These are great. These are spatial pictures. They're very detailed. They show a lot of detail. They show a lot of different the intricacies in the brain. You can tell if there's been, if someone's had a stroke and there's been damage and things like that. They're great. Unfortunately, they do these after people have concussions just to make sure, and they should, and that's all part of the protocol if it's severe enough to do that. But the thing about MRIs and CAT scans is that they show a lot of spatial function. In other words, they show a lot of detail, but they don't show what's called temporal, over time. They don't show kind of like a reading over time. Even though it takes 30 minutes to do these things, it's pretty much a picture of the brain. We need something to look at the function, because most of the time with concussions, mild concussions, which are mild traumatic brain injuries, there is no structural damage. That you can't see anything wrong with the brain tissue, and so it's all functional. Something's not firing. The person may have fatigue, or they may have depression, or they may have balance problems, and all this is about nerve cells not connecting the way they should prior to the way they did prior to the injury, the concussion. So what we use here in my office is a few things. We do what's called a QEEG, and what that is a reading of the brain waves produced by your brain. A brain wave is basically an electrical signal that can be determined or captured on the scalp, produced by the firing of nerve cells within the brain, and it gives us a very, very detailed picture of a temporal or a time frame over time and what those brain waves are doing. So you should have certain, there's about 4 different brain waves, and they all have a certain size and they do different functions, and they, it's sort of like shifting gears in a car. You have slow gears and you have fast gears. Well, our brain's the same thing. We have fast brain waves and slow brain waves, and when we take a picture of these brain waves, we can tell which ones are, fast. For example, you should have a little bit faster brain waves in the front of your brain than in the back of your brain. So oftentimes during concussion, people have depression and things like that, or attention problems, because now there's the opposite has happened. We have where there should be fast brain waves in the front, then now slow brain waves, and that can cause problems like personality changes, aggression, anger. People say, I used to not have all these emotional problems before my concussion, and now I do. That's sort of an example of what actually can happen. So how we take this is we do a very specific test called a quantitative EEG. It's different than a EEG you would get in the hospital if you had a seizure disorder or something. That's more of a raw data. They just sort of show normal and abnormal. We take each of the 4 brain waves and we can tell if they are too big, too small, too fast, too slow, and we look at each one of those. We put basically a little swim cap on top of the head like this, and it reads there are 12 different sites, and feeds back to a computer and gives us a snapshot. We have the person with their eyes open and then their eyes closed, and because certain brain waves are more predominant when you close your eyes, you have more your slow brain waves that start to happen, are produced more when you close your eyes. If someone, for example, closes their eyes and their brain waves, their fast brain waves increase, they may have problems with insomnia, for example. If people have too many certain brain waves on the left side, left hemisphere, versus the right, they may have depression if there's what we call alpha brain waves in the left hemisphere. So that's just an example of the symptoms that can happen, can come about with a change in brainwave patterns. And the good news is we can actually do something later to train the brain waves. If, for example, they're slow in the front of the brain, we can speed them up through training, and other videos I talk about specifically the training with that. But this really gives us a really good idea of what the person's brain is doing just on a regular day, in the morning preferably, and they just sitting there and maybe focusing on a little dot with the eyes open, and gives us a good idea of just sort of a baseline picture of the brain. And we use that in case there's a concussion that in the future, we can look at and see where the changes have been made and where in the brain the changes have occurred. Another thing we do, are part of this, the baseline testing, is we do that, which is the main thing, the QEEG. We also do balance testing with a computerized balance board. We actually have the person stand on a platform, and it reads and tells us how well their balance is for their age group. It sort of gives us an average for their age, and if they're really off, and if they're young and they're 15 years old and they're failing all these balance parameters for their age, it's a problem. We can really see, and we can tell before and after. If they swayed to the left a little bit and now they sway both sides after the concussion, we can tell that they may have more of a vestibular problem, and that just gives us a good idea of how far they've gone off track with that type of thing. We also do a regular neurological examination where I have people follow my finger with their eyes. We track their eyes. We look at eye reflexes. We tap their tendons, make sure we check the strength. We actually check their necks. A lot of times concussions, a lot of the symptoms that people have with headaches and such is actually from injuries to the neck, which often go undiagnosed. And as a chiropractor, we can correct those, especially the upper cervical spine gets twisted and things like that. I had a patient where she was who was a cheerleader, another cheerleader came down on her head, and she had a lot of headaches and a lot of problems months and months and months after the concussion, and it was actually the injury to her neck which was causing all the symptoms. So this is part of what we do. We have a special right now we're offering, I think it's $100. Typically this would be several $100s for for the whole thing, but I really want students to get these baseline tests so we have an idea of how much work they have to do to get back to pre-concussion. And it's really, really important. We want to really help these kids save their brains for the rest of their lives. I mean, you get one brain, and you want to keep it as healthy as possible, as long as you possibly can. Okay? If you have any questions, please call our office at 631-265-1223, and you can find us on the web at newlifechiropractic.com. Okay, take care.
Hello, how are you?
Well, how are you?
Good.
Thank you so much for coming in today
No
and
problem.
sharing your story with other people. We're hoping this is helpful.
Yep.
So, what brought you to Brain Core?
Well, a while back I had a football concussion, and it was very bad. It was giving me abdominal pains, and I wasn't really able to sleep.
Okay.
So, yeah.
And so, before you sought care with me, you had been to other doctors and
Yes.
to other kinds of modalities. What things did you do, and what didn't seem to really help you so much?
I went to a GI doctor for a
Okay.
long time, and that didn't really help me. I went to a couple of like chiropractic, but like different places, and
Okay.
they weren't really helping.
Okay.
So yeah, that was really what I tried before I came.
And how did you find Brain Core?
My mom really on the internet, she looked
Okay.
it up and she found you guys. Yeah.
Excellent. So tell me, remind me, what was your life like before Brain Core? What were you struggling with?
Yeah. Well, I wasn't in school for a
Mhm.
whole year. I had home tutoring, and I couldn't sleep, and I would really just want to stay in my room. So I was very depressed, and I would like moan to try and take care of the pain.
Okay,
yeah.
So the pain was so intense. You
Mhm.
were totally out of school.
Yeah.
Okay. You weren't really able to leave your room. You
No,
were doing
yeah.
homeschooling basically.
Yeah.
And as far as going to Western medicine, you really weren't getting anywhere.
Yeah, I wasn't really getting any results or anything.
Okay.
Yeah.
Okay. And so then you came here and we met.
Yep.
And Tom was always, for everything he'd been through, he was still really open
Yeah.
to trying something,
Yeah.
right? And I did a brain map on him, and I found a form of dysregulation that's associated with things like chronic pain. So we spoke about trying neurofeedback. And so tell them what happened.
So in about the first week that I started, I was able to sleep better. So that was always a plus, because if you don't sleep, that's terrible.
Right,
So
that's where we repair, right?
Yep.
Is in restorative sleep. Great.
Mhm.
And then what happened a few months later?
then about 2-3 months later, I noticed that my abdominal pain went down.
Great.
So that was always good. Yeah.
Excellent. And so how is your life different now?
Now I'm back in school, and
Excellent.
I'm glad to say I'm sleeping through the night. So it's very good. It's much more enjoyable than what it was.
And how about the depression and specifically the chronic abdominal pain?
The abdominal pain, I haven't had it for a long time, and I hope I never have it again. And and the depression, I'm fine. I'm the same person that I used to be.
Great.
So I'm glad I am. And so
Great.
life is much more enjoyable than
Excellent.
it was. Yeah.
Excellent. So you're happy you found Brain Core.
Absolutely. Yes.
and what other things you had spoken about, faith and other things out there?
Before I came here, all the doctors, they would tell me, oh, there's things and they made it sound like I was faking it. So that was very upsetting to me, because it's me, and I felt the pain. So when I came here, I was trying to be as open as I could, but I really didn't have much faith in anyone, really. And then once I saw that I was sleeping and stuff, I just had all that back, because now I knew that I actually had hope that I could feel better.
Yes.
So, yeah.
Well, I'm so happy that
Thank you.
neurofeedback helped
Yeah.
you.
Thank you.
And I can say that he was always one of my favorite patients because he was so appreciative of the changes.
Thank you.
And he followed his protocols very carefully.
Mhm.
And we're happy to say that this is all behind him now.
Thank you.
Thank you.
Thank you.
I guess probably when I was about in my mid-40s, my youngest daughter was showing signs of ADD, so we went and we investigated her, and I was not very receptive to any of the normal clinical things that people do. So I did a lot of research, and at that time when we were doing all that research, it became very apparent that it was something that I have struggled with my whole life. Back then it was just called the ants in the pants and not being able to focus. So when we started her on a medical protocol, I guess, at the same time or thereabouts, I went on one myself. And I guess I was on it for about 4 or 5 years, maybe a little bit longer, and then got introduced to New Life and learned about BrainCore and decided to try it, and just have had fantastic results. Totally med-free. My youngest daughter we've reduced her medicine. My oldest daughter has anxiety issues, and she's seen great improvements with it also.
Chris came to me and we did a diagnostic procedure on her called a QEEG, and what we found is she also had an elevated theta-beta ratio, which is seen in 85% of people with ADHD. It's really the classic hallmark sign to let us know as BrainCore doctors that we can effectively help a patient. After 20 visits with Chris, she saw a dramatic improvement. In fact, she's completely off medication and has maintained that for over 4 months we're at right now. So really dramatic result within way under the 30 visits.
I have recommended BrainCore to pretty basically anybody who I meet because I think the benefits are far-reaching. I think, I have 3 different examples in my family. My youngest daughter is ADD. We've been able to reduce her medicine. I have ADD. I've been able to come off medicine. My oldest daughter has anxiety issues, and she's just been through some pretty anxiety-induced circumstances with college, and she made it through fine. So I have very concrete proof that it does work.
People take medication every day for anxiety, depression, even insomnia. But a new technique could make it all go away by simply using your brain power. CBS 2's Andrea Grimes shows us how you can train your brain.
When it's light or bright, that's when she's producing the desired brain wavelength.
That's right. This patient is manipulating the brightness of the screen with the power of her mind. It's a treatment called brain core therapy.
Your brain is constantly being molded with a feedback mechanism, a positive reinforcement to show you that this is the proper brainwave pattern.
Positive reinforcement for this therapy entails making a video screen appear lighter, or here, keeping a roller coaster moving smoothly. It works, according to Dr. Carrie Chapino, by patients concentrating on these activities. She says research shows that over time, the brain will establish new connections that can help break the cycle of depression, insomnia, and certain pain.
I'm not about to get a facelift, but I can give my brain a lift.
Marilyn Sokol says she was having issues with mood, focus, and trouble sleeping, so she tried brain core therapy.
I'm really sleeping and not getting up for any reason.
She saw other benefits too.
I was always a slow reader. I do believe that there has been an improvement.
Brain core neurofeedback therapy begins with a comprehensive evaluation. This evaluation includes a quantitative electroencephalogram or QEEG evaluation. During this evaluation, we are able to read and record brainwave patterns at 12 different sites in the brain. Our software then identifies where the brainwave patterns are abnormal, and then the neurofeedback protocols that we use are designed to specifically address those patterns that are abnormal in that particular patient. So for instance, if a patient is producing too much beta waves, the neurofeedback protocol for that patient would be to teach them how to produce less beta waves. And we do that through operant conditioning or a learning modality. A good example would be where the patient is hooked up to the computer using wires that are pasted to the scalp. It's completely non-invasive. There's no pins, there's no needles, it's painless. And those wires are basically just reading the patient's brain waves coming from their brain. The computer software then is going to reward the patient when they're producing the correct brainwave pattern. So, for instance, the reward might be a DVD that the patient is watching. They could be watching a movie, and the movie is either going to play when they're producing the correct brainwave patterns, or stop when they're not producing the correct brainwave patterns. This is simple operant conditioning. Over time, the brain learns that if it wants to see the movie, it's got to produce the correct brainwave patterns. The brainwave circuitry is then reestablished in the brain, and the new activation patterns that have been produced by the brain can now be used out in the normal environment. So now the child who was in the classroom falling asleep is no longer falling asleep, because they know now how to produce more beta waves and less theta and delta.